Chapter 7, Experiencing Health and Illness. Again, the disclosure statement, I don't own this material under fair use. I'm providing lecture content for only my nursing students using this material. All content within is only for educational purposes for nursing students and does not provide medical advice. So, health and illness, two spectrums, right? So there's the health end of the spectrum and the illness end of the spectrum. Thought process on that. What does health mean? If you're thinking about health, what is that picture in your mind? Having the perfect body, not having any illness, something you can buy. These are myths, right? You don't have to have the perfect body. What is the perfect body? It's different for everyone. Not having illness, technically that's a misnomer because from the minute you are alive, you start the illness process, right? Especially if you were a NICU baby, you understand that the illness is real in infants as well. So, not having illness doesn't mean that you're healthy because you can have an illness and have no signs and symptom management and still consider yourself healthy. Okay. And then something you can buy, regardless of all the ads out there, there is no special pill that gives you health. There's no special fountain of health. Okay. So this different definitions that somebody might tell you, it's really a subjective thing. It's not an objective thing. It's a very subjective thing. So think about what health means and then think about what illness means. What does it mean for you? We all know, twins or sisters or people in the same family that have the same disease but have a different outlook on it. So one person might think diabetes is a death sentence, and one might think, oh, this is nothing. This can't control me. Okay. So health is defined as the ideal state of physical wellness and mental well-being, a positive concept emphasizing social and personal resources as well as physical capabilities. So are you considering yourself healthy if you're socially, you have family, you have personal resources, you have people to talk to? Are you bringing that into the concept as well? Or is it just physical? Okay, so you really want to look holistic, HOL, not whole, HWOL, right? So you want to really look HOLISTIC, holistic health. Spiritually, socially, personally, do I have the capacities that I need to get through daily life? The power of the soul to cope with varying conditions of the body. That is also a definition of health. So do you have the ability to cope in the conditions that you have? Experience is unique to each individual. Like I said, it's a very subjective thing. And illness is usually described in terms of how it makes you feel. Okay. I'm good, I'm healthy, I'm grateful, whatever. It's usually based on a feeling illness. Okay. If I don't feel good today, illness. You don't necessarily hear that with health. Okay. So illness is that presence of disease or presence of a disease process that's making you feel ill, right? So illness is considered a disruption of health. Think about appendix. If you're got appendicitis, it's an immediate onset, acute, it's going to be done and over with as soon as I get my appendix out. It's a disruption of health. I was healthy, now I have this appendix thing, and then I will go back to health. Health and illness are influenced by a client's attitudes and lifestyle choices. Again, two sisters in the same family could have totally different attitudes and lifestyle choices that makes their perception of health and illness very, very different. So it's a very subjective thing, and you have to ask the patient, how do they feel? It's usually the first question we ask. It's usually also measured on like a 0 to 10 scale. The client with multiple sclerosis can no longer walk or urinate on their own. They spend the day sewing quilts, reading, communicating via email with the support organization. Which word describes this client? So just think to yourself, what is that considered? What would you consider that? Would you consider that a healthy patient? Would you consider that an ill patient, in poor health, or well? Here's a key with that. What's the definition of wellness? Right? They are not considered healthy because they do have a disease process. They're not considered ill because they're not enjoying life, right? So they are actually described as being well, even though they have a disease process, because the data suggests that despite physical incapacities, a client that continues to live life as fully as possible is well. So different health illness continuum, Dunn's health grid, Newman's continuum, there's different conceptual models to help you understand health and wellness and illness and all that good stuff. So we'll go over some of those. If you're considering the dimensions of health along health and illness continuum, again, like I said, 0 being, dead, 1 being gravely ill, and 10 being in excellent health. So you tell them, give me a scale of 1 to 10, and they pick a number there. Okay. So someone with the same disease could cause it to be a different number, just like pain scale. Okay. There are different things that come into play with that, biological factors, nutrition, physical ability, the ability to still get out of bed and stuff might affect the way they say that. Sleep and rest and meaningful work. Okay. So right now, what would you consider yourself on this? A lot of you might be like 9, 10, other than the stress school is causing. Some people would think 1. Okay. So it's always one of those questions that we kind of ask on a scale of 0 to 10, where are you with health? 10 being excellent health and 1 being gravely ill. Lifestyle choices, family relationships, culture, religion, spirituality, environmental factors, and finances also play a big role in there. So when somebody tells you that they're not doing very well, consider asking to follow up with that. Tell me more. The answer on the NCLEX will always be tell me more, not just the usual suspects of the other answers on the test will be, you're fine. Oh, get over it. Oh, you'll be okay. You really have a lot to be thankful for. Those are things we never say. We don't know. We don't know their perception of their health and their wellness. We want to ask further questions to ask them more about, do you have a support system? Is your culture, is your religion, how's your environment, right? If we don't ask questions, we don't know how they got to that number. There could be resources that we need to provide or provide them with the number for resources to be able to be healthy. What's the goal of a client health history? To gather data about nutrition, exercise, leisure activities, spirituality, and home environment. What's the whole goal? Why do we do this? Technically, you'll hear a lot out there about oh, we have to because of regulatory agencies. That's really not the reason we do it. To assist physicians in developing a medical diagnosis. It helps them. That's not the purpose that we do it. To gather data about the causes of the client's illness, or to increase the client's awareness of lifestyle choices and their role in wellness. So why do you think we go through a full health history when a patient comes in the hospital or in our care? Okay, so it's really not about following through on their illnesses, but also to reward them with their health as well. So it's really about increasing the client's awareness of lifestyle choices and their role in wellness. Okay, so gathering data about lifestyle choices, activities, values helps you to make a better plan of care with the patient to capitalize them, help them with capitalizing on strengths and also reducing and recognizing the deficits that they might have, especially requiring education to help the patient modify, like smoking cessation. If a patient says that they smoke, we are regulated to hand them a smoking brochure, but what is the goal of it? It's not to meet the regulatory. It's to give them a resource when they are ready. Okay. So we're also not beating them over the head with it, but we do have a, a responsibility to educate patients. So, what kind of factors could disrupt health? So I'm sure somebody here has had something go on in their family or not personally, but that has disrupted your health. So consider physical disease and injury, mental health, pain, loss, impending death. Almost every single one of you will have gone through this personally or in family. You know that there's a broken leg as a child, can't go to school, can't go to gym, has to go to study hall for 3 weeks, something like that. Asthma, does it disrupt my health? It's a illness process. Some days it disrupts my health. Okay, so these are factors to consider how healthy or how ill you are. Just some ideas that you would ask someone. Loss can really interrupt your health pattern. Okay, just think about the last time you lost a loved one. It set you back for a few days minimum. Some people grieve differently and they get set back for at least a year or two. So everybody responds differently. Dunn's health grid is on the screen. So it's a continuum from peak wellness to death on one axis, health axis, and then the environmental axis. It's the other one. So environmentally, is it a very favorable environment or a very unfavorable environment for your health? So we kind of look at this in maternity, especially with a new baby, right? We're looking at how well they are. If they're in the NICU, they're in a special classification that they are not a normal newborn. They are a protected newborn. They have special needs potentially, and we also know that can really influence their wellness on a trajectory of their life based on what environment they are in. So there are moms who decide to put their babies up for adoption because they know that they don't have a very favorable environment. So we can change these axes by doing education, protecting patients, things like that. Just like in hospice care, you can also put a hospice patient in here. If it's a very favorable environment, there's a loving family at home, there are people who want to take care of the patient at home, we can do that at home. But there may be a very unfavorable environment where there's a lot of strife, drama going on. Perhaps that's better to go ahead and put them in a hospice house or a hospice situation where it's a more protected environment where we know that the patient's going to get their meds and be pain free. So just consider the health grid as health on one axis and environment on the other. We're constantly thinking that. We may not think Dunn's, we may not put a name to it, but we're constantly thinking about this and what the environment that they're going home to and how able they are to get better in that environment. So Again, competing demands, the unknown, imbalance, isolation also are big factors that we take into consideration. If someone has competing demands, just consider you're taking care of your mom and your grandma and you have children. Are there competing demands? Will you even be able to take care of yourself? Many of you may feel this right now because you've got competing demand with school, you've got to take care of your kids, and your parents are calling on you, or grandparents potentially calling on you to care for them as well. How can you how can you do everything? You're going to have stress. You're going to break down, right? The unknown, someone loses their job. I don't know what that looks like. I don't know how I'm going to pay for insurance. I don't know. How am I going to do dialysis? How am I going to get my chemo meds? The unknown is a big factor. When we know that there's something wrong with the patient and their environment, then we can help fix it or provide resources to be able to provide them help. Isolation, especially if we know they don't have any family and they don't have anyone here to take care of them, we start talking in case management rounds about, is there a daughter that they can go live with? Is there a son? Is there a group home? Is there an assisted living situation? Because isolation is probably the worst thing for people who are elderly or sick because there's no one watching how they're doing. If they're experiencing symptoms or not, if they have sick role behavior, if they are seeking professional care or not, if they're dependent on others for their care, and the recovery are the 5 stages of illness behavior. So, first, you experience symptoms. You have a sore throat, right? The sick role. Oh, I'm sick today. I can't come in to work. You start the sick role behavior. You're acting differently. You're quieter. You don't want to be social. You kind of pull in. Then eventually it gets to a point where you're like, okay, I need an antibiotic. I need to go get seen. I need some help here. That's seeking. And then dependence on others, it may or may not happen based on if you're a mom or a dad with kids that have to rely on you too. But sometimes you will lay, oh, yes, please fix supper tonight. I can't do it, and then you go into the recovery phase. These are the normal signs and stages of an illness behavior. You can see yourself doing that whenever you have the flu, COVID, whatever. You know that you went through those stages. Those are the normal stages. The problem is when people stay in the sick role or stay in the dependence on others and they don't come back to recovery. That's the bigger issue. So the client has received a prescription for a metered dose inhaler. Before the client leaves, the nurse instructs the client on how to use the inhaler, and the nurse is tending to the client's needs in which stage of illness behavior. So the nurse is in which stage? She came to the clinic and you're providing information and a prescription on a metered dose inhaler. So they are depending on you. Okay, so they're already sought medical care. They already identified that they are sick. Okay, so now they're dependent on you to give them that prescription. Then they can get into the recovery phase. Okay, so they have sought medical care. So they accepted the diagnosis and treatment and is now being given instructions regarding follow through. How do I get better? So, factors that influence illness behavior, the nature of the illness, is it just a sore throat or is it cancer? Is it something acute or chronic? The hardiness of the person. Have they faced illness before? Intensity, duration, and multiplicity of the disruption. So, how bad of a disruption is it? Is it just a sore throat, or is it going to mean they have to go part time at their job or not work anymore? That's a whole different illness behavior. Nature of the illness, is it acute or chronic? And are they in remission or exacerbation? So you'll see these terms. Acute illness means right now and it will end. Chronic means it will continually get worse over time and it's a long-term disease. Arthritis, it's not going to go away. Remission means they have an exacerbation or it's coming back. Okay, so we'll hear the word exacerbation a lot in COPD. Asthma, asthma exacerbation. It means I was doing well, but now I got in the presence of an allergen and my allergies are going crazy. Or it's raining, causing mold, and now my asthma's exacerbated. Okay, so using the nursing process from the other chapter that I recorded, you want to use that to promote health. So the assessment is facilitating communication. Okay, so you facilitate communication to find out where they are, to assess. Are they settling in, accepting, enjoying? Where are they in the assessment process of accepting this illness? Time, focus on their main concern, and observe. That's being a better communicator. If you are rushed, they're not going to talk to you. Make them your main concern. Don't be doing 3 other things, checking on your cell phone and everything else. Focus on their main concern. Why are you here today? Right? That's all the time. All the time, that's what we say. Why? Tell me why you're here today. You don't want their whole life story. You just want, why are they here today? And then observation, right? Because sometimes verbal and nonverbal can contradict each other. Diagnose, so you think about what they have told you and make a nursing diagnosis related to the health illness issue. So if they say, well, I have the flu, but I don't want all my whole family to get it. You think about that and you think about the nursing diagnoses, and that might mean knowledge deficit. Maybe they don't understand how to keep their family members from getting it. So you do a little outcome planning and evaluation. You go ahead and assess, diagnose, intervene, provide the education, evaluate your education. So do they say, oh, okay, so if I use Lysol, that will help? If they wash their hands frequently, if we don't share dishes, okay? So then you envision what you expect for them to tell you back and then set that goal. Hopefully they say, I'll get the flu shot next time and have better knowledge. Planning interventions, implementing your plan. Again, envision the strengths and the potential in the client who are too overwhelmed to identify their own implementation. So this is where we come up with a plan with them, for them. So a nurse using the caring approach with a client who to influence healthy lifestyle changes. The best statement by the nurse is, so think about your therapeutic communication. I would like you to perform this exercise once a day. Your physician has left orders for you to follow. The laboratory tests reveal that you need to reduce your daily percentage of fat grams. Adapting your diet and activity will lower your blood glucose levels. Which one is the caring approach? You want to motivate them to change, right? So telling them, I would like you to perform these is not going to be their motivation to do it. Telling you the doctor left these orders for you, that's passing the buck on the doctor. The doctor said, do this. That's probably not caring approach, okay? So caring approach, C sounds to the data says, right? The results are. That's not really caring. Caring says adapting your diet and activity will lower your blood glucose levels. It's a caring manner of saying, if you do this, the trade-off is this. That's a caring atmosphere. Okay. A caring approach involves consideration of all factors that might affect the client's well being, not just physical, not just labs, not just numbers, but influencing them to make a change. Find out their motivation to change. Okay. Illness may necessitate a change in lifestyle more fast than another. So, obviously, diet, activity, sleep patterns. If you are told you have diabetes, you don't have years to make a lifestyle change. You need to do that right away for your physical well being, your labs, things like that, that you need to change. So, what interventions can you suggest to help them adjust to the change? No one changes overnight. Okay. Change is a circular process, it goes around in a circle. They will fall off, they will come back, they will start again, they will fall off, they will come back, they will start again. Weight loss, diet, exercise, smoking, drug use, coffee use, whatever your drug of choice is, we got to realize that change is not linear. You are, you're not. It's going to go in a cycle. So helping that person to suggest different changes, little changes that they can do every day, incremental goals. So describe past experiences that influenced your thinking. So ask them personal experiences, work experiences, what has worked in the past for you. Okay. So think about your own when you've had to make a change in your lifestyle. What interventions did you do? Small steps, maybe cutting out 1 cup of coffee a day, 1 soda a day, replacing it with 1 water a day, right? So small incremental goals, no one changes overnight, cold turkey, most of the time for lifestyle change. How can I honor each client's unique health and illness experience? So examine their life uncertainties with them. What do they know? What do they not know? What do they have control over? What do they not have control over? Envision their wellness. So envision wellness for them. What does that look like? Do it with them to establish that trust and that goal. You want to establish your trust at the first client contact and throughout the transfer and discharge from care. You're establishing trust because otherwise they won't show back up for their second appointment. And providing a healing presence, knowing that people are going to fail. It doesn't cause them to be a bad person. So being in a healing presence makes you more apt to come back, seek more care. Being in a not healing environment, being yelled at about needing to lose weight or needing to stop smoking and those kind of things will not be a healing presence. You all know that. You've all experienced that probably at one time where you're like, okay, that's not the person I want to go back and see again. And then being able to think like a nurse. What qualities are essential to your own personal definition of health? And how do you define illness? So think about that. Know your own goals, your own thought process on that. Where are you on the continuum of health and illness? Will really impact how you talk to others and how you treat others. Also in that manner, people who are very very healthy can come off as demeaning to others that are not so healthy. People who don't smoke can come off as demeaning to other people who smoke. Okay, so just being honest about that and know that your biases are there and they might come out. We want to provide a situation where it's an unbiased approach, that people are free and willing to make their own choices. We can't make them do anything. We can help lead them to knowledge and how to change. But at the end of the day, it's their motivation to want to change that's going to cause them to change. All right. That's a little bit about wellness and health.